Hello students, today we will discuss about the diagnosis of diabetes mellitus. So we will diagnose a patient with diabetes mellitus. Diabetes, a condition in which blood glucose level increases from normal. It may be due to absolute insulin deficiency like in type 1 diabetes mellitus, or it may be due to insulin resistance like in case of type 2 diabetes mellitus. तो सबसे पहले जो फर्स्ट क्राइटेरिया है इसको डायग्नोज करने के लिए वो है कि पेशेंट इज़ सिम्टोमेटिक. इफ़ पेशेंट इज़ सिम्टोमेटिक ही हैज़ सिम्टम्स लाइक पोलीयूरिया एंड पॉलीडिप्सिया विद वन abnormal venous glucose on one occasions plus symptoms. So we will measure the fasting blood glucose level if it is greater than or equal to 126 milligram per deciliter, or random blood glucose is greater than or equal to 200 milligram per deciliter, then we will label a patient a diabetic. Second criteria, if the patient is asymptomatic, then he has abnormal venous glucose on two different occasions. Abnormal venous glucose is same, fasting is greater than 126 milligram per deciliter and random is greater than 200 milligram per deciliter. Third criteria is HbA1c. HbA1c is actually a glycated hemoglobin, a hemoglobin to which a glucose is attached. So it will tells us about the average blood glucose in the previous 3 months. So if it is greater than 6.5%, then we will label a patient a diabetic. And the fourth criteria is oral glucose tolerance test. We will perform this test in case of borderline cases or in case of gestational diabetes mellitus. So we will prepare our patient for oral glucose tolerance by a unrestricted carbohydrate diet for the 3 days and overnight fasting for at least 8 hours. Then we will measure the plasma glucose after 75 gram of oral glucose load. 75 gram of oral glucose load के 2 hour बाद, after 2 hours of 75 gram glucose load, we will measure the blood glucose level. If glucose level is greater than 200 milligram per deciliter, then the patient is diabetic. And last thing is the normal and impaired glucose tolerance. In case of normal patient, the fasting blood glucose is less than 100 milligram per deciliter, and in case of impaired glucose tolerance, a patient is pre-diabetic. In this case, the fasting is less than 126 milligram per deciliter, and 2 hour glucose is in case of normal person less than 140 milligram per deciliter, and in case of impaired glucose tolerance it is 140 to 199 milligram per deciliter. A patient with impaired glucose tolerance has increased risk of developing a diabetes mellitus, almost about 5 to 10%. So this is all about diagnosis of diabetes mellitus.